COVID is not a joke. COVID is here to stay. And I will go through the figures or the statistics that we have in the National Control Center. And that I must also emphasize that this is not the absolute figures we would like to have if we have all the testing, all the results on daily basis, active live figures. But nevertheless, the figures we have are real in giving the overall snapshot of the situation, real situation we have on the ground. As of 20th of March, which is last Saturday, to 27th of March, which is 7 days as from today, you'll be alarmed. And nation, people of this country, everybody, all the stakeholders, everybody take this very seriously. As of today, 27th, and 7 days from last Saturday, we have a total of 5,184 cumulative. And of that, last Saturday we had 2,790. Almost 50% of that result is just 57 days. We have 2,394. So you can imagine, within the 7 days, we have almost 50%. The total of 5,184. It's not a joke. And of last Saturday, we had a total death of 36. The cumulative, the 7 days, we had 9 deaths. That gives us a total of 45 deaths. So it's not a joke. Going back to Professor Saisi Kewau, Professor John Wins made it very clear on Thursday brief we had. It goes to show your aunties, your uncles, your mothers, your fathers, and those households that we share on Melanesian culture, that it's not a joke. Take this triple passing, non-pharmaceutical measures very, very seriously, as put out by Controller and NCC, and the support that we're trying to have this strategy, isolation strategy. Please take this seriously. We are in a red zone, and it's not a joke. Within the 7 days, we have the test which shows almost 50%. And that's almost 40% of the last that we had in 36 on Saturday last week, and 9 giving us a 45. The real issue is, if you're not serious about it, if you don't take the people are passing seriously, where do we go? Hospitals are right to the brim. Port Moresby Hospital, of the 18 beds, we have 16 beds fully occupied. So you imagine 50% of that in 7 days. And if you're not careful, where do we go? When you are not careful about and have the symptoms, moderate to severe, there is no ICU bed. Of the 6 ICU beds, 4 are full. So within the 7 days and from now on, if you're not careful and follow the Nupala Pass in the message we put in, if you're sick and come down with more symptoms, severe to moderate, where do you go? There's no bed. And that's the reflection in Port Moresby Hospital. That reflects the whole country. Engau, for the matter, is closed. The 50% of the staff are affected. As we move on with the same cumulative incidents and the situation we have, where do we go in Engau? Where do we go in the rest of the hospitals in the country? The bad situation, and more importantly, the staff. Frontline health workers are stretched to the limit. They are in the burnout. So country, people of this country, everybody take note of this serious situations that we have. And each and every one of us must take the ownership. When we take the ownership, Controller and myself and our staff and all the frontline health workers throughout the country and the PHS, it's not a joke. It's not a joke that we would like to do that because it's part of our job or responsibility. We are doing it out of necessity of the incidents and situations we have in the country right now. So tomorrow, when we have another media, presentations, our CEO, Dr. Malum, will be here to give you the results and situations as we speak on the ground from today, 24 hours by tomorrow. And the Rita Flynn, of the 43 beds, almost 90% of the beds are occupied, or almost 95% of the beds. We have occupancy of about 39, 36 on a daily basis. With this said, with the numbers that are going in, where do we place the rest of them? So we have no choice, but for those who are improving but still complete their 10 days or 14 days of recovery, we are getting them to go home. But to go home and home isolation is not a big task, because we're living in the communal family society, where at home there are more than 3 or 4 families put together, about 20 or 10 in the household. It's a challenge. It's a challenge. So we take the risk sending them home to have the home isolation quarantine. So message now and going forward, let's take this seriously, each and every one, take the ownership. And thank you, Controller, thank you, NCC, thank you, our government, Prime Minister, our ministers, Police Minister, and the Health Minister, doing everything possible for your good, for the greater good of everybody. We will have shortly by Monday, Tuesday, when our team from St. John's put together with our team, thank you, DFAC and Australian government for giving the funding, technical support to have the Tauranga Activity Center be open hopefully by Monday, and we take some of the load of PNG, Port Missouri Hospital, and Rita Flynn. But that we would have to start with 120 beds and would have 50 patients or so transferred to a mile from PNG and Rita Flynn. But that would not solve the problem. Let me re-emphasize. If you have 50% from 2,500 and then 2,000 added in just 7 days, even the Rita Flynn, even the Tauranga Activity Center will not be an answer. The curve is going up over the red line. So the measures we put in, having the strategic isolations of limiting the travel from inter-provinces, inter-locations, zones are important. If we take it seriously, going forward from here 7 days, hopefully we'll have the curve on a plateau or coming down, but that's alarmingly so. It's not happening now as we speak. So let me reiterate, please, once more to all our people, citizens of this country, stakeholders, business houses, let's take non-pharmaceutical measures. Please respect and comply with the measures put in by our hard-working controller and the NCC team, our Prime Minister, our Health Minister, all the agency of the government. We're making all the effort. So please, everybody, let's put all our effort together. If we all put our effort and take ownership of this, hopefully by within a week or two, we can see a plateau that should give us a bit of comfort. At the moment, it's a nightmare. I can't feel comfortable right now as I speak. So please, people of this country, take this seriously. COVID is real. COVID is here to stay. Let me take this time to just give a quick brief on the vaccines. 8,000 of, thank you again, with goodwill of people of Australia and government of Australia, the 8,000 vaccines we have here. That we only for frontline health workers who have risked themselves, those in emergency PNG, emergency section, in Rita Flynn, they're getting in numbers. Staff are exposing themselves, taking the risk of themselves and their family. And all our frontline health workers in the private health facilities in Port Moresby. We will have those priorities for our frontline health workers, plus all our essential workers in immigration, point of entry, even our police, those in the front line also supporting us, getting the message and also helping us in the message that we can put in place will be the priority. I'll thank you, Australian government, DFAT again, engaging through funding support, through technical support, through international SOS, and the logistics and sorting out of the rollout is ready, but obviously we need the full names of all our frontline health workers from our public institutions in the hospitals, Port Moresby General Hospital, National Capital PHA, and the rest of our health facilities and private health facilities, the numbers of the names of those we are getting. And I'm also happy to say that of those that had the hesitancy, were in doubt or were in limbo, we are now getting positive response and numbers of the health workers who are now coming forward. So we finalize the names, get the registration documents ready, and hopefully by Tuesday we'll have the rollout done, and it will be done through the sports rugby sports all sets rugby sports stadium, and we'll finalize that, and when the rollout starts we will also announce it by tomorrow and Monday going forward. Thank you.